started. Good morning, everyone. I am Don Williamson, the 2020 chairman of the Corona Chamber of Commerce. And today is a beautiful day in Corona. Thank you so much for joining this call. Our staff works hard every week to put this call together and to make it something that's of value to all of our members. And we want to thank you for taking advantage of this member benefit. Once again, today I'm going to be sharing the agenda with our chair-elect, Kim Maybon, who's the owner of Creative by Design, and she's going to be providing details and announcements as this call proceeds. So today, or right now, I'd like Kim to share with you about today's sponsor.
Thank you, Don, and good morning, everybody. Today's event is sponsored by IHOP Corona. Whether you're hungry for one of their popular breakfast items or looking for lunch, dinner, or late night dining ideas near you, our Corona IHOP is just around the corner at 2450 Wardlow Road. Known for being an favorite American family-style restaurant, they now proudly offer takeout and delivery options. They have a large professional outdoor dining setup, so you can dine out and still maintain distance and follow safety guidelines. Back to you, Don.
Thanks, Kim. As a reminder, and for those of you that are new on the call, there will be time for questions for those who give presentations today, but we don't just shout out our questions. Please use the chat box and type in any questions that you will have. And then Stephanie Shapiro will go through those questions, and in case we have duplicates, then we don't have to have duplication. So please use the chat box. The Corona Chamber of Commerce really strives to be a force of good for our business community and help you in any way we can. And we want to be your resource for prosperity, especially when things are not looking so chipper as they did in 2020. But boy, we're almost out of this year, thankfully, and we'll be able to look forward to hopefully a new beginning in 2021. And you're going to hear some critical updates today. And Kim has a couple more things to tell you about.
Thank you, Don. These updates are here to help our members, and if you happen to be on this call but are still not a member of the chamber, or if you know of a neighboring business that would find chamber membership beneficial, please connect with Robert Yanez to become part of our chamber family. We service a regional landscape, and we are not bound by geographical limits. If you refer a member, you will receive a free advertisement in the Corona Business News. We also have incentives for referrals and new members who join before the end of 2020, so don't delay. Don?
Thanks, Kim. And just on the Corona Business News, inside there's a lot of really great advertisements. We have a restaurant section in the one we have out this month, and you can sit there and pick a place to go to, which I have done fairly often recently. So please support our members and join the chamber and renew your memberships. It's very important. Part of that is helps our next speaker, our legislative advocate, Jeff Gibson. And for those of you that missed last week's call, Jeff Gibson and Jeff Miller gave an incredible outline of 2021 project that we're starting with. And so, 2025. Please listen to last week's if you get an opportunity. Jeff is part of the Occidental Communication Group. He keeps his hand on the pulse of all government legislation and helps us be, he's one of our greatest tools to help our business community that we have. So at this time, I'd like to welcome Jeff Gibson.
Thank you, Don. I appreciate it. Yes, keeping your hand on the pulse of everything going on in Sacramento and Washington, D.C. is sometimes like standing in front of a fire hose. But so the thing that we're keeping track of today, so there's been a couple of updates from our last update of last week on election results. Prop 15 has been called. Prop 15, which would have split the tax roll for property tax assessment and gone after reassessing all business and mixed use properties in violation of Prop 13, of what we now have as Prop 13, did fail. It failed by about 700,000 votes. So we do expect that, unfortunately, to probably come back in some form in 2022. And in some form in the legislature. It has been every year since the passage of Prop 13, there has been a bill to eliminate Prop 13. And so this is one of the things that we're going to be working on. The second piece that we're tracking closely today are the development of the governor's emergency orders on COVID-19. I know, and I don't want to speak to anything that Hospital Director Uffer is going to be giving us in a couple minutes. One of the problems that the California Chamber of Commerce has had, and the California Chamber and almost every business group has taken a different position on these emergency orders because the drafting was different, in that Cal OSHA, our good friends at Cal OSHA are going to be drafting permanent regulations that will take the emergency orders and make them permanent. Whether or not there would be a pandemic, we are now in negotiations with the governor on your behalf to make sure that whatever is temporarily necessary, and we're not disputing that there are things that need to be done on a temporary basis to handle a very real health threat. So we'll want to take that off the table. We're not disputing anything about the health effects or any of that. Our dispute is that at some point there will be a time in which it is inappropriate to continue to require you guys to make these investments on an ongoing basis. And unfortunately, California is currently the only state that is considering permanent regulations, as opposed to just telling us who is an essential business, for instance. The reason I said that they're drafted differently is when the governor announced, for instance, in March or in any of his previous announcements on what is an essential business and what isn't, and we can have a debate over that, and definitely we want to make sure that every single person on the call understands that we believe that if some businesses can operate safely, that many businesses can operate safely. Well, this time, in the enabling legislation, in the enabling language the governor used, he has not been specific enough on what an essential business is. And so we are trying, and we thought initially, the coalition that this chamber and several of my other clients are a part of, thought initially, well, that's a drafting error. Well, unfortunately, they then followed up with another series of pronouncements the next day, and still the error, the quote unquote error, is there. So they had the opportunity on day one to fix it. It's not fixed yet. This is something that is very important, because obviously if the emergency orders, as they start to go into effect on Friday, if they are put into effect and do not have the appropriate language, then the effects are going to be even worse. You're going to start to see major businesses start to close. So I'm confident that that problem will be handled. And so is everyone in our coalition. But as of right now, I cannot report that it's handled. So these are the types of things that we're handling for you. It's not just, well, the legislature comes back into session in December, and we're going to plan a trip and do those types of things. It's oftentimes, especially in cases of emergency, it's a moment by moment exercise. And again, we want everybody to be safe. We have no dispute over any of the health issues. Our issue is that in every previous order, there were some very specific descriptions of what an essential business is, what it is, and how these businesses can either remain open or have to be closed or reopen, et cetera, et cetera. And we could debate those, but there was at least language. We need the language to say concrete is an essential business, Costco is an essential business, and then we can go back and say, okay, well, if these businesses can operate appropriately, then let's start to come up with standards so that more businesses can operate appropriately, and work to get everybody back and moving safely. So happy to answer any questions that you may have. Stephanie, is there anything in the chat?
Thank you, Jeff. We do have one comment question. It says, thank you for supporting the small businesses. All jobs are essential. Says, ask any child if their parents going to work is essential for their food on the table, electricity, and a roof over their head. How can we actively work on getting the governor on board?
So we have been, so first, totally completely agree. And I have flown on flights, and there's been 1 billion boardings of aircraft just in America since the first order, and there have been 44 proven cases of transmission of COVID, and no fatalities from those cases. And so if the airline industry can do this, if the grocery industry can do this, if colleges and universities can do this, there have been tens of thousands of cases of transmission of kids in college. I have one currently at a school that had 785 cases. But according to the CDC, there are no verified cases of any deaths. We don't want anybody to get this. It is a dangerous disease, but there are organizations that are working through this safely. And again, we want to underline safely. And it is essential to have kids in school. It is essential to have parents at work and doing the things that we have legal rights to do over the long haul once we're out of the emergency. So what you can continue to do is to the governor has an email address at his website. There is a if you just Google or DuckDuckGo or whatever search engine you use, just COVID-19 California. I believe it's covid19.ca.gov, but I do not know if that's the web address. One of the first links that comes up is the governor's website. You can petition him directly there. We continue to work as a group to let the governor know on a weekly basis, both through the county of Riverside and their efforts, the city, and then our larger business coalition at the California Chamber to handle the same representation that that comment made, that every business is essential and that every business needs to be given a path in which to reopen and pursue operations. No one wants to operate unsafely, or at least the vast majority of people want to operate in a way that doesn't hurt anybody or spread any sort of disease. And we know a lot more about this after 9 months than we did when the first time that we had this phone call. And we really want, and the thing that we're putting a lot of energy in with the governor is for him to be pursuing policy that reflects the increase in that knowledge, as opposed to going back to where we were in March and just saying we need to have a full and complete lockdown.
Thank you, Jeff.
Thank you.
Stephanie, another question?
Yeah, I have one more question. Sorry about
Sure.
that. Why did the governor's executive orders never get taken to court?
They have been taken to court. He has been sanctioned by the Superior Court. And so this is an extension of his current orders. So he cannot issue new orders without new legislation. And so that's why he's going out of his way to underline that this isn't an expansion of a current executive order, that this is a refinement of a current executive order. Unfortunately, his refinement is actually an expansion, and it isn't clear on, and it isn't me saying this. There are lawyers that have looked at this and said, so hold on, wait, before you implement this, you need to tell us, you need to have, and we're not talking about a huge, long reference point. We're talking about two sentences, let me get them up there, 2 sentences that would not change his order in the least. And it's taken us now 5 days. So sometimes that's the way that goes. So especially if, say, your governor was caught indoors at a 5-star restaurant at a $50,000 plate fundraiser, I'm just throwing out hypotheticals, and then went to, say, go skiing at Squaw Valley, which was also under his emergency order. So if you had a governor that did that, then he might be a little distracted to say the 9 million Californians that are employed by essential businesses can continue in their jobs. So yeah, it's normally I am as happy and perky as I possibly can be. This is extremely frustrating given the circumstances. So I personally, and I know Bobby and I know Dawn and everybody on this call, if you're unfamiliar with this call, please understand that we know completely the stress that you're going through. Many of us have been small business people. I've been a small business person for 30 years. And I understand completely having to not know what's going to happen next in these scenarios. So we're literally, I was texting with Bobby at 3:30 this morning. So it says something about our relationship. He can text me at 3:30 in the morning and know he's going to get a response. So about this call. So that's the level of seriousness that we're taking your job, and we're not just saying, oh, it's just essential businesses.
Jeff,
I'm
thank
sure
you
Bobby's very happy to have another person to chat with in the dark hours. We have one last question if we have time for it, Dawn.
Absolutely.
Okay, great. What do you think the likelihood is of imposing new stay-at-home orders like we had the initial shutdown back in March, statewide?
So this is the concern. So under the so back to the court order. So the court ordered that he could not issue that the governor is not empowered under the Emergency Services Act. There is an Emergency Services Act. It has very specific standards, and essentially you get to extend it one time. And so the court, and I believe rightfully so, went ahead and said, okay, you've extended this now several times and issued several different orders, and you haven't gone back to the legislature. The idea of it is, if there's a real emergency, the legislature would give you the authority almost immediately. There isn't going to be a huge amount of debate. And so the court is really asking the governor to go back. The legislature comes back into session the first Monday of December, when all of the new members are seated, and the House the Assembly elects its speaker, et cetera, et cetera. And at that point, they can pass emergency legislation that would give the governor more authority to extend or do those types of items. The governor has changed his strategy on this from of the metric, and currently we're tracking just new cases. And so if the metric is going to be based on new cases, I have a great sense of trepidation that we could be seeing additional lockdowns. If we go back to some of the other metrics that we have been using and counties have been doing very, very well with, whether it's fatality or hospitalization use or any of those. And again, all I'm doing is describing. I am not advocating that he go from one to the other. So that is not what I do. I'm just describing to you. But if he stays on the current metric, it seems that there is a high probability that we would be looking at lockdowns into basically the first of the year, if not sooner. So that is a concern that we are tracking, but we'll have more on that on this call. So we definitely will be handling it.
Thanks, Jeff.
You're welcome.
Any more questions, Steph?
There was one last question. What about Airbnb? Is that going to be closed?
So that I can't speak to. I would imagine most of those have already been closed based on the requirements, but I'm not specifically familiar with Airbnb. We can look into it for you. Airbnb generally are regulated by cities and counties in which they're in, whether you're allowed to do a short-term rental or you have to pay a tax or issues like that. And I know that they fall under the health department as well. I would imagine they would fall just like any other business under the same requirements that would fall on hotels and short-term apartment leases, which would be there under the most restricted, the purple or whatever the color coding is. basically have a 25% occupancy.
Thank you. No more questions.
You're welcome. Thank you, guys.
Thank you. And Jeff, as always, we truly do appreciate your efforts on our behalf and keeping us up to date. Thank you so much.
You're welcome. Thank you.
At this time, let's turn it over to Kim.
Thank you, Don. Next Tuesday, November 24th, we have a very special labor law update seminar. This 1-hour Zoom session will update you on the labor laws coming into effect in 2021. Our guest speaker is Joseph Ortiz, a partner at Best & Krieger and newly appointed judge. Only registered guests will receive a playback of the session, so if you can't attend live, sign up anyway to ensure to receive the material. This is a co-hosted event by one of our great partners, the City of Corona. Don?
Thanks, Kim. On Monday, December 14th, we will be having our final Coffee with an Entrepreneur. We're going to have a wonderful guest, Chantel Blash. Chantel is a Medicare broker with Meridian Pacific Insurance Services. She has a great backstory. Very interesting person. Just as a little teaser, I'm going to just say 2 words: Europe and a carnival. So you want to listen to what that all means, because it'll be very informative for you. This is a free event in partnership with our number one partner, really, in many ways, the City of Corona, who shares our mutual goals. And so to RSVP and sign up, please contact the link there on the screen right now. You'll really enjoy listening to Chantel. This is a series that we sponsor with the City of Corona that's been very successful, and we get a lot of positive feedback. So please be sure to join us. Now we've come to our main topic on today's call, coping with COVID. Here with us today, we have FDAs for both our school district and the hospital. First, I'd like to welcome from the Corona-Norco Unified School District, the Director of Student Services, my friend, Dr. Pablo Sanchez, and Coordinator of School Counseling Services, who I'm not friends with yet, Anita Shirley.
Thanks, Don, and good morning to everyone. Happy Wednesday, and thank you for inviting us today. Well, we wanted to basically just acknowledge a couple of things. First off, that the Chamber of Commerce for Corona, you employ our parents, right? And so all of our children, when we're not in a pandemic, they say goodbye to the parents as they go to school, and their parents go work for you. And so we acknowledge those pieces, and we understand that. And today we wanted to just share some resources with you, because there is, when it comes to the mental health piece of our students, and it's always a difficult topic to broach. As you know, there's some stigma behind it, particularly in some of the households. You know, that's not, we and generationally, some of us that were not raised to understand those pieces, and yet it is quite a hot topic now with our youth, in terms of how they're coping with the negative impacts of not being able to go to school on a daily basis, not being able to see friends, and those pieces. So today, again, we just want to make sure we share some of those resources that are that we're taking care of from our end in the school district. These are going to be free. There's no cost to any of the membership for the Corona Chambers, and we would love to see your partnership continue in terms of sharing this information with our families. So with that said, I'd like to turn it over to Ms. Anita Shirley, who is going to share some of these resources with us now.
Hi, good morning. I am going to stay behind my picture this morning. So Pablo and I are amending at home, so I'm going to be staying behind my picture this morning. But I would like to share, I don't know, Stephanie, am I able to share my screen, or is that not a possibility?
You are.
Okay, so I'm going to, okay. So I wanted the number one resource that I really want to share with all of you is this program kind of liaison program that we have with our district called Care Solace. And what Care Solace is it's a concierge service that we have partnered with that is free to all of our families, but it extends farther than that. So our students, it is free to our students, but then it's free to the students' extended families, and which means it's almost available to our entire community, for lack of better terms, because our families can reach out to this service to get the services that they need. So it's really to help link families to mental health services, but also to drug and alcohol addiction services. So what we found through resources and people contacting us through COVID is that our families are struggling at home. They're struggling for a variety of different reasons, depression, anxiety, how to just navigate a variety of different things. But what this service does is it helps families navigate, if they have insurance, their insurance, to get services that they need. But it also, if they don't have insurance, it helps them link to low cost or free services. And so that's the other really important part about this, is that we know that our families, some do not have insurance. And so this will really help our families get to service that they need, even if they don't have insurance. And we don't want insurance or the lack of insurance to be a block to get the help that they need. And so Care Solace is free to them because the district has decided to take on for lack of better terms, the burden of paying for the service. The other is that our school counselors, so I'm not going to ever step away from ever talking about what our school counselors can provide for our community. And so we have 86 school counselors in our district, TK through 12, and our school counselors are always a resource to families. And so if you have employees that are needing help, they can always reach out to the school sites and just ask to speak with their school counselor. They don't need to know the school counselor's name. They just need to say, I need to speak with a school counselor. And then the school counselor has a variety of other resources in their pocket and in their tool belt that they can help link families to also, because there are so many resources within the community, but every family is different, every need is different, and they know what is available. And if they don't know, they know how to research and to get the help that our families need. And they really are a really tight system of people also. So if they don't know, they know where to go to get the resources for our families. And so that's the other piece that I really wanted to speak to also, is that our school counselors are one of those other resources for the community. I don't know if there's any questions or if you wanted to say anything else, Pablo.
Stephanie, we have any questions for Dr. Sanchez and Ms. Shirley?
Yes, we have a couple of them. Thank you. Just 1 second. So you had mentioned being able to call and talk to a school counselor, but regarding the Care Solace program specifically, are there live people to chat with on that if somebody needs help figuring it out?
Absolutely. So I was able to provide Stephanie with that flyer, or Bobby with the flyer. So I don't know if that went sent out. So yes, that is something you don't have to reach out to the school counselor for. You can just reach out. There's a phone number on there or a website. You can just reach automatically out to that resource without reaching to the school counselor. The other beautiful thing about that program is they have, I believe, over 20 languages that they have have options for families to be able to speak to people with. So it's not limited to just English or Spanish, which is a blessing in our community because we know families have more than that in our community also. So yes, they can just reach out to Care Solis specifically.
Great. And you had mentioned also that this is available to any student in the district and their families.
Yes.
If somebody doesn't have children in the district, are they able to partake in any way for a fee, maybe?
Not necessarily, but if they reach out to me, I'm always available, and then I can maybe figure out a different way for them. So I don't want there to be a stopgap because they don't have a student or a family member in the Corona-Norco Unified School District for Care Solis to not be an option for them, but I can figure out a different way for them.
Great. Is the district going to be giving more computers out to kids who are in need?
Yes, we are in the process of doing that. One of the pieces that we just transitioned is we had a centralized mode in where folks were coming to the district office in the city of Norco. We are now transitioning that process to the school sites individually. So we still encourage parents to, if they need a device, to go on through Parent Connect app and sign up for it, and then you'll be contacted to get your device. So, and that is both a Chromebook and or a hotspot if that is needed.
Great. When speaking on mental health, how is abuse and domestic violence being monitored and more so acted on?
So that's being monitored from a variety of different avenues. So our students are on Zoom daily with our teachers. And so our teachers are mandated reporters along with all staff members at our school site. So if our teachers are noticing anything suspicious as part of the law states, then they are reporting to CPS as per part of their role as a teacher. Similar to our school counselors, if they notice anything or are suspicious of anything, then reports are being made. Many times our teachers or other parents who notice things in the community, they also reach out to school sites. So there's a constant line of communication to the school sites, and our school counselors, our administrators, our teachers are always, I wouldn't use the word always, but they are mandated reporters, and they are making those phone calls as needed based off of the suspicions of domestic violence or child abuse.
Thank you. And the last question we have, we have two more now. What is the district doing to help with children and students with the recent rise in suicides and attempted suicides?
Yes, so there are, one thing that you don't know about me, but fortunately and unfortunately, suicide prevention has been one of the many passions of the work that I've done for the last, 10, 15 years of my career. And so even before COVID, we as a school district have had protocols and procedures in place. And this year we are, and in years past, our teachers are trained in a program called Cognito. It is a program that they do simulations on how to have conversations with students who are talking about suicide or mental health problems, and it guides the teacher and administrator and staff through having those conversations, and then always back to getting them help. And we have those protocols and procedures in place, and the Cognito always turns the teacher to get the student help to our school counselors. Our counselors then go through their protocols and procedures, and we're very lockstep with our protocols and procedures, that if a student says this, they must do X, Y, Z. If a student says, and it heightens their senses on what the student is saying, if it is more explicit on that they do have mode of actually following through with their plan, then they have different protocols and procedures that they follow through on. So our district, although we can't know every facet of every student's inner workings and thinkings, we truly have a place in our, we have board policy surrounding it. We have protocols and procedures in place that our staff do follow so that we can address the needs as they arise and are presented to us. If we don't ever hear about it, there's not too much we can do about it, but we are marketing a variety of other things. Also, we have hotline numbers that we market. We have a text line that we push out to our students. We really want to make sure that that we are a resource, but that the students know where to seek help when they do have needs that arise on the weekend or late at night and that type of thing also.
Thank you. We actually have a few more really great questions, but because of the additional things we have in our program today, I would like to put them in the chat if you wouldn't mind answering them there. And
that sounds
that
great
work for you?
Yeah, absolutely.
Okay, great. Thank you so much.
And again, once again, Dr. Sanchez, Ms. Shirley, I want to thank you so much for joining us today and giving us incredible information that is really a big help. I don't know how many people realize that the #1 employer in Corona is the Corona-Norco Unified School District, making our partnership here at the Chamber with the district essential. And to have you and people from the district come on and give us information, we're just very grateful, and it enhances our relationship. So thank you both very much. At this time, it is my privilege to introduce our keynote speaker, the Chief Executive Officer of the Corona Regional Medical Center, Mr. Mark Uffer. I'll tell you, I've lived here, as you know, most of you, over 60 years, and it would be unimaginable back then to see what has come to Corona as far as medical services go. And really, they have never been better than they are since Mark Uffer has taken the helm of the Corona Regional Medical Center. He really has risen what's available here in Corona to what would previously been unimaginable quality, and it's really an honor for me to introduce him and have him on our call today. Mark.
Hey, thank you, Don. Yeah, I was just on a corporate call, so I thought I was going to be running a little later than this, so I was able to get off of that and spend time with you this morning. Thank you for the kind words. Certainly means a lot. You know, it's funny, in my healthcare career, I spent the longest stint I was in a hospital as an executive was at Foothill Presbyterian, where I spent 13 years, and I'm at 8 right now with Corona. So second longest stint in a hospital. Certainly has been fraught with many challenges. I know what the community perception of the hospital was, and I think we've done a lot to change the image, like you say, and add services. When we first started this process, you know, Aaron Spiegel and Jason Scott basically challenged me to live up to some of the expectations that they had, and I hope we've done that. We had when I got there, we just basically did general surgeries, and we did a little bit of community medicine. We now have a functioning cardiac cath program where we can do stents and angioplasties, and we can do robotic surgery, which is, you know, the latest and greatest that we added this last year. That was a $2 million purchase. Been quite successful. We're now doing bariatric surgery for patients. We do a fair amount of orthopedic surgery. We have City of Hope physicians on our staff now working on cancer programs. and we just continue to grow. Unfortunately, our growth and our current profile is just getting slammed because of COVID. And everybody asks me every day, what do you think of this? And what I think of it is, and I'm quite blunt and I'm quite out there about what I'm going to say, but we need to have people listen to the scientists. It's the only way we are going to get through this. I know there's a terrible need to have businesses open and functional, but not at the expense of what we're seeing. We actually saw a decline in COVID after the last surge, to the point where we were only seeing 5 or 6 patients a day that were rule out COVID. We're up in the 20s a day. We only have 7 isolation rooms at Corona Regional. We had 40 patients in isolation yesterday. Now, 2 things are happening. COVID and the spread is rampant right now. This is not some political hoax created by the Dems or the Republicans. This is a very real healthcare crisis, the likes that we have never seen, and I hope we never see it again. I've been doing healthcare since 1973. I was a clinician at the bedside when I started my career. I have never seen the impact of what I'm seeing right now. And frankly, if people don't stop it and wake up and start doing what they're told to do by the scientists, we will not get a handle on this and probably until sometime mid to late next year. It's out of control. And it's so simple. It's so easy to fix, but people just don't want to be inconvenienced by wearing a damn mask. It's that simple. Wear a mask, socially distance yourself. Don't go do things right now that you don't need to do. If your life doesn't depend on it, you shouldn't be out doing things. And it's a little bit of pain for a whole lot of gain. I mean, we're seeing this on a national stage. You have a Republican president who basically is a sociopath, narcissistic person who's basically made this a political issue. And his refusal to wear a mask. I mean, the guy got COVID himself. His family got COVID. All he had to do was wear a mask and socially distance. And, all he had to say was, people, a little bit of pain. Let's retrench our thought process. Let's wear masks. Let's not go out in public. Let's shut things down for a while. I know the impact on that is grave, but, we could have got a handle on it. So we slowed down. We got the first wave through. And now we got into the second wave. Now we're in the third wave. Third wave is by far worse than the first and second. Now, the good news is that the illness is not quite as bad. We're not seeing the severity of illness that we saw on phase 1 and phase 2. For whatever the reason, people just haven't gotten sick yet. I mean, I've heard everything from fevers and aches and pains to a little bit of fatigue. I do have a personal friend who is in a hospital in Glendora as we speak. He's been there 3 weeks with pneumonia, and he's on high flow oxygen, and he's likely going to survive, but it has not been pleasant for him. So I struggle. I was in I was out last weekend, and I went to run some errands, and my wife and I said, well, let's stop at one of the local restaurants and see if we can get some takeout. Takeout is quite safe. Most restaurants have done very well figuring out how to do takeout, evidenced by Chick-fil-A, In-N-Out, McDonald's. They're all doing a great business right now. They're not starving at all. But the takeout, the actual coffee shops and things, there are some that have done very well. Well, I went into this one. I called the order in, and when I got there to pick it up, I walked in the lobby, and it was packed full of people. Both sides of the aisle, some wearing masks, some not wearing masks. And then I went to the counter, and the guy that was behind the counter had a plastic shield on with no mask. Okay, not smart. The mask does nothing. The plastic shield does nothing. And then I said, well, where do I get my takeout? He says, we'll go over there to the counter. Well, when I looked around the restaurant, it was completely filled with people. no social distancing, open for business, business as usual. And when I asked for them, when I walked out, I called the manager on the phone. I said, I thought the county said no eating in. We're not following the rule. We choose to not comply. That is why COVID is spreading. That is a simple reason right there, right in front of your face. That's why it's spreading. People are still having parties. People are still getting out in large groups. Those are all things that are super spreader events. I happen to know a CEO in the region who has COVID. And how did he get it? He went to a golf tournament. It's just unfortunate that, the message that I try to preach to people, and I'm getting tired of doing it because nobody listens, is that, if we could just settle down for the next 90 days. We got Thanksgiving coming up. We're going to get a spike after Thanksgiving. We got Christmas coming up. We're going to get a spike after Christmas. We got New Year's coming up. We're going to get another spike. If people would just shut it down for the next 90 days, the vaccines should start coming out in December to the high-risk groups. Everybody says, well, would you take the vaccine? Of course. There's been more scrutiny on the vaccine from COVID than there has been on the flu vaccine. The damn vaccines are 90% plus effective. Do they cause pain? Yeah, they cause pain at the site. We get that with a flu shot. You could get a headache, you could get some fever, you could get some aches and pains. It's 12 hours and you're done with it. You got to have 2 injections. Moderna, Pfizer, these companies are not going to put a vaccine out on the street that subjects them to millions and millions and millions of dollars of lawsuits if they have something that's unsafe. It's not a live virus that they're using to create the vaccine. It's a synthetic. So it does work. I mean, so that should come out in late December. We'll start seeing it. You'll start seeing the elderly population, the healthcare frontline workers getting it. I'm sure there's going to be some mass delivery, either using the military. There'll be somebody out there getting this out in a mass way so that we can get people vaccinated. But that's 90 days, and if we get through the initial phase of the vaccines, by February or March, if we can get enough out there, we can end some of these lockdowns and get back to life as we used to know it. But again, it requires incredible discipline right now to get through this. Everybody's beating on the governor. I mean, there are death threats coming into some of the governors and mayors that have made decisions to lock things down. If they don't lock things down, 200,000 people will die. That is not a number that we should look away from. It's been put out there on the media every day. I mean, people like Sanjay Gupta, Fauci, I mean, these guys are not idiots. They are scientists. This is their life. And, I've talked to every pulmonary critical care doctor that I can talk to. I've talked to every infectious disease doctor that I can talk to. And they say the same thing. Shut things down for 90 days and this will go away. And we can get the vaccines and life will get back to normal. I was at, I have a couple of horses. I was out at the horse ranch Saturday, and I'm walking my horse around, and I see one of the guys that lives at the ranch, and he says to me, he goes, I don't really believe this is real. I think it's a hoax. How do you deal with that? What it will take is for his 80-year-old father to get it and die, and then he'll understand that it's not a hoax. None of those people wear masks. I've never seen a mask at the horse ranch. I wear one. My family wears one. I'm at the opposite end of the spectrum. I won't go anywhere without a mask. So it's very unfortunate. Your hospital, believe it or not, has one of the lowest mortality rates of any hospital in the Inland Empire. Corona's done a very good job with Dr. French and Dr. Akhavan and Dr. Kim. The patients that come into the hospital, we've lost probably 60 patients since this started, but we've seen, over 2,000. So our mortality rate is very low. What are we doing different? High flow oxygen. We try to keep people off ventilators. Ventilators are a last resort. Most people that go on ventilators don't do well. We treat them with high-dose steroids. We use remdesivir, although remdesivir has its own side effects. It's tough. It's really hard on the kidneys. We have just gotten approval to start using some of the new, what they call monoclonal antibodies. That's the same stuff they gave Trump. He got a drug called Regeneron. This is a drug that I can't even pronounce. We call it the Bam Bam drug, but it's a monoclonal antibody, and we should start to get some doses of that in. That's for patients that have already been diagnosed that are at high risk, and you can give it to them, and it does seem to help them. It obviously helped Trump. Nobody really knows how sick he was. But the reality of it is, if I had one message that everybody should carry back to the community, is it is not a hoax. This is not a political issue. Politicians need to stop pontificating on how we should manage COVID. We should leave it up to people like Fauci and Dr. Kaiser at the County of Riverside and the public health officials. They're the experts. This is what they train to do. I have never met a politician that has a medical background that could talk the language that we're talking and really understand what they're talking about. Their focus is on saving business and getting people, back to work and the economy. But we can't do that if we keep having these super spreader events and these surges. And the current surge that we're in is by far worse than the prior two we saw. So, God willing, people will listen. And I would say for 90 days, it's going to be it should be a different Thanksgiving, a different Christmas, and a different New Year's. And then we should get back to normal because vaccines will be out. And by June of next year, hopefully this would be a distant memory. But if we still have the knucklehead behavior out there where people think it's okay to, go into restaurants without a mask on or go into stores without a mask. I did talk to Riverside County 2 days ago. The number one county that's in trouble right now is San Bernardino County. Riverside County is second. The spread is occurring in grocery stores, industrial warehouses, and restaurants. Personally, I wouldn't eat in a restaurant if you put a gun to my head right now. I'll starve. I have not gone to a restaurant since February. I have not done anything but takeout. I'm not going to eat outside in a tent at a restaurant. I'm sure these are quite harsh comments, but this is what people need to hear. The healthcare industry is so tired of this because we're paying the bill. My nurses are worn to a frazzle. They're tired. My director of ICU works 14 hours a day managing patients in COVID. Then she goes home because her kids are out of school because they can't go to school. And she teaches her kids. And then she does it again the next day and the next day and the next day. I have nurses that want to walk out. They don't want to work anymore. They said the public doesn't care about us. They run to us when we're sick, but they're tired. We're tired of this. It's easily controllable. Wear a damn mask. But people won't do it. So that's the message that you all need to take out there in the community. Wear your mask, socially distance, shut down the unnecessary events, and let's get through this, and then we'll survive it. But if we don't, I personally don't like seeing somebody die when it's totally preventable. This is a preventable disease. This is not like AIDS. This is not like HIV. I mean, this is not like that. I mean, this is preventable. We know what causes it. We know how it spreads. And so, unfortunately, people aren't listening. And as I was on a call with all the hospital CEOs, we're getting ready to draft letters to the Board of Supervisors and advise them that they better stop making decisions relative to healthcare and, that they don't have any knowledge about. They need to listen to their scientists. They need to listen to what Dr. Kaiser says and what the health director and all the, I don't know if you know it, but health directors are quitting their jobs. They're quitting because they're of the political pressure that's brought on them because they're employed by the supervisors. The health officer reports to the Board of Supervisors. So if it's kind of like Dr. Fauci and Donald Trump, everybody's afraid to say no to Donald Trump. Same thing at local level. So I think the public has to just stand up and say, you know what, we understand what causes this. We've got to shut things down for at least 90 days. And I think every time we've done it, the infection rate declines and we get back to some sense of normalcy. And it's because people follow rules. For some reason, the American public doesn't want to follow rules. So that's my message for this morning. It's not a pleasant message, but it's a direct message. And it's uncomfortable, but hey, you know, if that's what it takes to survive it, I personally want to survive it. And I don't want to see anybody I know die from it. And I know people that have had it that have been quite ill, and it is not a pleasant thing to have. So with that, I'll open it up to questions.
Thank you so much for this information, Mark. It's very timely and important for us to hear what you told us. So thank you. Stephanie, do we have any questions?
We do have several. Is it okay with you and Bobby if we go a little past 11 today?
Yeah,
absolutely. Absolutely.
All right, great. Okay, so first question. Mark, do you think that those coming in with the virus are experiencing less severe symptoms now because they are seeking care sooner, or because the treatments have improved?
Both. I think that, you know, the friend of mine that I had, he waited 15 days before he went to the hospital. And when he was diagnosed in the hospital, he had pneumonia. So yeah, they are coming in a little sooner, and sooner is better because at least we can identify that you have it, and then we can develop a treatment plan. You know, some people, no treatment, just watch and wait, but at least you have some medical supervision. And then the ones we are seeing, the symptoms are a little bit less this time. So we don't know if that's scientifically, because it's directly correlated, from what I understand, to the amount of virus that you're exposed to. So, you know, that could be contributing as well. They may just get a passing, you know, a 10-minute exposure, and maybe they get a lower dose of the virus, but we really don't know.
Thank you. Is wearing a mask guaranteed to stop the virus?
There's no guarantee. I can tell you that, you know, the regular surgical mask is a very effective mask. The cloth masks that are layered are effective. The magic bullet is the N95 mask. You can now buy those at Home Depot. They're 95. They stop 95% of the particles. You can get them at Lowe's and Home Depot. What's not effective are the handkerchiefs that people put over their face. What's not effective is people wearing the nose down below their nose with their nose sticking out. It's a respiratory virus. Your nose is part of your respiratory system. There was a lady that was thrown out of a fast food place a couple days ago that the owner was telling me about. She took a mask and she put sequins on it, and then she tore the back of the mask out, so it was just sequins, and it was absolutely ineffective. But masks, nothing is 100% effective. But, you know, N95 is 95%. And if both people are wearing masks, even better.
Mark, one of our attendees today would like to schedule a Zoom meeting with your team about how to reduce length of stay and inappropriate antibiotic usage. What is the best step for them to follow?
Well, if they're a physician, or if they have, you know, they can contact my assistant Rosa and see if you can get on the calendar. I mean, that's something we do every day. I mean, we don't use a lot of antibiotics unnecessarily. I mean, we're pretty regulated by how we do that, and length of stay is a function of illness. So right now, our length of stay is affected by a couple things. You know, nursing homes don't want to take patients that have COVID. They want to send us patients that got COVID in the nursing home, but then they don't want to take them back. So there's a lot of factors affecting that. But yeah, I'd be willing to talk to somebody.
Regarding shutting things down for 90 days, how would this time be different than the last shutdown? How severe of a shutdown would need to happen to get a handle on the virus, in your opinion?
I don't think it has to be. It's not as painful as people make it. I mean, if you look at the restaurants that are still open, if they have a good takeout system, it works fine. People are still going to eat at the restaurant, just going to get takeout. And so, I mean, simple thing like you call it in. You don't queue up in a line when you go to get your food. They have clean pens, they have dirty pens when you sign your receipt. They have a workflow that's made to deal with infection control. That works fine. Movie theaters, you know, that's a super spreading environment. Indoor dining, it's been proven. It's not that the indoor dining is the problem, it's the airflow. You know, if you have an older building and you have an indoor restaurant, your air exchanges are less. So indoor dining hasn't been proven to be a way to control it. Outdoor dining, if you're going to have a place that's outdoors, you want two sides open. You don't want to be going in, oh, we got a tent now, that's outdoor dining. No, that isn't how it works. You know, the shopping, I mean, if people are wearing masks, and enforce the policy. I mean, I tell you firsthand experience. I went to Home Depot, and there was a guy in Home Depot in the aisle that had no mask on. And one of the other patrons said, "Hey, are you special? You don't have to wear a mask." He said, "Why? Are you afraid of me because I'm not wearing a mask? This is just a big hoax." And, you know, some big guy came and escorted him out of Home Depot. A patron physically removed him from Home Depot. Said, "I'm not afraid of you. I'm afraid of the virus. The mask is to protect all of us." So those kinds of things, I mean, you could still shop. You can still get takeout food. You can still get your hair done. You can still get your nails done. Wear masks. It's just that simple. The mask is the most important thing.
Thank you. What would you say to those who are concerned about long-term effects of the vaccine?
Like I said, I don't think anybody has given this. Think of it this way. In 2009, we had an outbreak, a flu pandemic. It was H1N1. I don't know if anybody even remembers that, the swine flu. And a lot of people were really sick, and it was killing people. It was a very, very bad flu. That was 2009. I bet there's nobody on this call that even recalls when the vaccine from H1N1 came out. And what happened was, and I'm a healthcare guy, I didn't even know when it came out. What I learned was, and I was afraid of it because it was a pandemic, what happened to my experience was the next year or 2 years later, when I didn't used to get flu shots all the time. And I went to get my flu shot like a year later or 2 years later, and the nurse that was giving me the shot says, "Yes, this has H1N1 vaccine in it." And I've not had side effects from flu shots. So I think it's the same thing. There's more scrutiny because of the COVID vaccine than there's ever been for any flu vaccine. And just so you know, the 90% plus, 95% plus they're talking about is probably one of the highest vaccine efficacies that's out there. I don't even think the flu vaccine is that high. So long-term effects, too soon to tell. It's not a live virus. So far, everything that we're hearing is there's some site pain from where the injection is, some redness. You get that with a flu shot. A lot of people I had my flu shot this year. I got a sore arm from it. If a sore arm is the worst of it, I'm in. Some people say that they've had some aches and pains and slight fevers, headaches, but it goes away after about 12 hours. Okay, those are short-term effects. Long-term, we're not going to know. But the odds are basically right now that if you do nothing, we're going to be in this pandemic for a long, long time. So it's just something that has to happen. And again, like I said, Pfizer is a huge company, Moderna, huge company. They are not going to sacrifice their long-term financial stability by putting something out there that has side effects that's going to hurt people short-term or long-term. I think they're going to be very careful.
Could the CEO you mentioned earlier have possibly caught COVID from somewhere else, or was it proven to be that he caught it at the golf tournament?
Nothing's 100%, but he was pretty well, and it wasn't one of our Corona golf tournaments, just so Bobby, you can breathe easier. It was another event that took place. there's no 100% certainty. I mean, he works in a hospital, and it's everywhere, in the hospital. But I can tell you this, in the healthcare setting, I have nurses that are on the front lines in COVID patient rooms, and they wear N95 masks and gloves and gowns. And I have pulmonary critical care docs and emergency room docs wearing PAPR suits. Those are the hooded suits with the airflow in them. And thank God we haven't had exposures. My infection control nurse sees every COVID patient that's come through the hospital, every one of them. And she's remarkably not tested positive. So the odds are it occurred in some area where somebody wasn't wearing a mask. He was in close proximity to them, and he picked it up. And fortunately, he wasn't very sick. He was just pretty tired.
Does the hospital and all associated care receive higher reimbursements from the federal government if COVID is labeled as being associated with their care or cause of death?
That's the favorite question all my friends ask me. You're just coding it as COVID so you can get more money. And well, the reality of it is that the federal government, when COVID hit, came out with what they call CARES Act funding. And just so you understand, the impact of caring for a COVID patient is incredibly, it's incredibly costly to the organization. Think of it this way: in a normal situation, patient comes in, they go into their room. They come in the emergency room, they're screened, they get put in an emergency room bed, they get taken up to the hospital bed, they spend their stay in the hospital, and they go home. COVID patient, any patient right now, doesn't work that way. We have to have 2 levels of screening. One, we screen them when they come to the emergency room to see if they have COVID symptoms. 2, if they have COVID symptoms, they got to go into isolation. That means masks, N95 masks, gowns, special room, negative airflow. Every time somebody goes into that room, physician, nurse, lab tech, x-ray tech, gown up, extremely expensive to treat them. Then they go to isolation in the hospital. Same process. Every time a nurse, dietitian, housekeeper goes in that room, gown up, gown out, gloves, masks. I mean, the cost is incredible to take care of a COVID patient. Do we get more for coding it as COVID? No. Well, we get money from the government for the amount of COVID care that takes place. It's a supplemental source of revenue that the government came up with to help us cope with the cost of taking care of COVID. The law is very prescriptive. You cannot code somebody with an illness that they don't have. That is a federal crime. So if somebody comes in and we say, oh yeah, code them with COVID because we're going to get higher reimbursement, that isn't how it works. We get reimbursed via the CARES Act. So that's where that fallacy comes from. People go to jail for what they call upcoding. So no, we don't do that.
How do we cope with COVID? What is Corona Regional Medical Center doing to combat all of the health issues related to people not getting out, such as mental health issues, cardio issues, obesity, etc.?
That's a great question. We don't have time to really go out in the community right now and promote wellness programs. I mean, we're basically drowning. Our staff is drowning in COVID patients and the impact on the system. We are seeing this about the same. Mental health hasn't, issues haven't really increased. We haven't seen any more 51 and 50s than we normally see. So that we're not seeing that. We know it is out there. I'd say the mental health of my staff is suffering. How do I deal with it as a CEO? I have a gym. I have a treadmill. I went out and bought a treadmill. I walk every day. I try to walk 2 miles a day and work out on the treadmill for 2 miles a day. I try to get outside in fresh air. At the end of the day, all we have is our families. When everything else goes to crap, if we're fortunate enough to have families, That's your bubble. Stay in your bubble. You know, how are we doing Thanksgiving? My daughter's flying in from Seattle. She's wearing an N95 mask. We're having an outdoor Thanksgiving. We're going to be like the Pilgrims. Everybody's wearing a mask at my house. No more than 10 people, outdoors, one person preparing the food. I don't want potluck. I don't want somebody bringing their COVID-laden mashed potatoes into my house. We're just going to be careful. And is it mentally healthy? No, it's not. But it's all we've got. It's like I said, it's 90 days of pain, hopefully for a lot of gain.
Okay, we have two last questions and they're related, but I'm going to break them up so they're a little bit easier. Should we rely on Pfizer and other pharmaceutical companies' vaccines? They had a $2.5 billion lawsuit for lying about side effects of their drugs.
Well, you know, it's kind of like who you're going to trust. I mean, I don't know of any drug company. Well, let's put it in perspective. Everybody watches television, right? Everybody on the call probably watches television. And on the television, they advertise new drugs. We have a cure for this. We have a cure for that, you know, and they tell you all of the wonderful things that are going to happen. If you have, you know, this disease, if you have rheumatoid arthritis, if you have, you know, skin rashes, if you have kidney disease, they have this new drug and they tell you all about the drug and they show you the happy person water skiing and flying kites and riding bicycles. We see that on TV every day, right? And then at the end, they tell you all the side effects you could have. Now, don't take this drug if you have this, 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 and this. And if you take it, this could occur. Well, I mean, they're not safe. They have side effects. It's a foreign substance. So, you know, are they lying? Did they get caught? I don't, you know. It's either take the drugs that come out. There's two different companies, and they both of their vaccines were made in the same fashion. Modern science, you know, I think we have to trust it because we don't have anything else. We could say, okay, let's not take the vaccine. Well, and COVID's not going to go away.
Okay, thank you. Last question. Dr. Fauci and other scientists have changed their stories many times this year. Who should the public believe? Do you think that what Sweden has done is a better path?
Who has done?
Sweden?
No. Herd immunity. It just came out in the last week that their herd immunity theory has not worked. They have a spike going on there as well. Here's my problem with Fauci. And his problem is no different than any other public health officer in the country. You hire people to do a job. Now, is he the best that there is? Probably not. He is the top infectious disease allergy specialist in the United States. He didn't get there by being a hack, all right? The problem that we have is that we have people questioning him. He's probably afraid to say exactly what he wants to say because it's been publicized, you know, Trump wants to fire him. I think every health officer will tell you the same thing. If they're allowed to do their job and practice science and let the masses hear the message, we would be better off. You know, if I was in Donald Trump's shoes, what I would have done is I would have gotten the top infectious disease specialists from Harvard, you know, all over the country. I would have gotten 3 or 4 of them. I would have had a national television conference with these guys there. And I would have said, I want you to give the message on how we control this virus. And I would have shut my mouth and let them talk. And that didn't happen. And that's why we're in trouble. I mean, the guy said it's a hoax. It's the China virus. It's going to go away. It's not that bad. Please. 200,000 people have died because of that theory. The blame has to, you know, when you're in a role like that, it's just like what I'm telling people today. You think anybody think I care what people think of what I'm saying? No, I'm telling you the truth as I believe it. I grew up as a scientist. I was a clinician before I was an administrator. I understand the disease. I understand what's out there. And so I'm going to tell you exactly what I think. If you don't like it, that's your choice. It's freedom. America's free speech. I'm just telling you what I think will protect you and will save us from further pain. And you know, I'm pleading with people, just wear your masks and socially distance. In 90 days, we would be way farther along. But look, we had to celebrate. We saw people on television. We had to celebrate the Lakers. We had to celebrate the Dodgers. We had public demonstrations. We have looting. We have all this kind of crazy stuff going on. Anybody who doesn't believe that it was a spreader, those are spreader events, your head's in the sand. Don't do.
Thank you, Mark.
Okay.
Oh, I'm sorry. I didn't mean to cut you off. I thought you were done. We don't have any more questions.
All right. Thank you.
Mark, we really appreciate you coming on today and spending your time to give us your thoughts and educate us on what's actually information we need to have. And also thank you for all the support you and the hospital has given to this Chamber of Commerce over the years. You're very invaluable to us, and thank you.
Well, that's a two-way street. And I like to thank Bobby for always asking me to do these things. And Dawn, I mean, it isn't always what you want to hear, but you're going to hear it. And that's just my style. And if I offend anybody, I'm certainly sorry, but the truth sometimes is painful.
It's a good thing, Mark. Thank you.
All right. Thank you so much.
We'll see you soon.
Take care. Be safe.
Once again, we'd like to thank everyone who participated on today's calls. We want to remind you that joining this Chamber of Commerce gives you benefits such as this call today. If you're not a member, please contact Robert Yanez. If you know someone who should be a member, please contact Robert Yanez. Remember, if someone you recommend joins, you get a free ad in the Corona Business News. Kim, do you have anything to add?
Yes, we also highly encourage you to follow us on our social media accounts. Get invited to our events and find out about the latest happenings through our Facebook page. Get tips on how to maximize your members' benefits and to get to know your fellow members through Instagram. Watch video and event recaps, helpful seminars, and more through our YouTube channel. See up-to-the-minute happenings on Twitter and connect with fellow professionals on LinkedIn. It's a digital age, and it's the best way to get real-time updates on what's in store for you, our members.
Thank you, Kim. Once again, I'd like to thank today's sponsor. If you're interested in sponsoring this call, please contact the Corona Chamber of Commerce. Today's sponsor, IHOP, is owned by Tom Coelho. Tom is a great guy. He has really answered the bell for anything that we requested of him. You know, we have lunch down there. It's great food. He does have it's not a tent, it's a sun cover. You can safely eat down there outside. It's open on all four sides to coincide with what Mr. Uffer just told us. And Tom is, like I said, just a wonderful supporter, not only of this chamber, but of the community. He arranges for cars and coffee down there for our Corona Chamber Foundation to benefit from that every week. So he's just a wonderful friend and supporter, not only of this chamber, but of our community. So again, thank you to Tom and to IHOP. Finally, next Wednesday, we will not be having this call. We're going to be dark. And when we come back, our Vice Mayor, Jackie Casillas, is going to be our speaker. We're also going to be reviewing our advocacy platform for 2021 and discuss rebuilding safely in 2021 and our plan to save you more than $10,000 by making California job friendly. Please register now for this and every call every week. You don't want to miss this information. As you found out today, it's really important to know. Good or bad, you need to know what's going on out in our business community to help you. So again, everyone, please have a happy Thanksgiving. Be safe and come back 2 weeks from today and we'll do it again. Thank you very much and have a good day.